Hello, this is Tricia Wonderly with Being Your Patient's Advocate. So to define what an advocate is, it's a person who speaks or writes in support of a person or a cause. Some synonyms to help understand what an advocate would be is a person who is a champion, a proponent, a spokesman or a spokeswoman, a campaigner, or a fighter. We would like you to promote your practice, promote your doctor, promote your team, and promote yourself. So the reason we have an advocacy statement is because we are about building trust with our patients. This is all about a relationship. With no trust, there is no relationship. So how do we promote ourselves? You need to be able to walk in cold and introduce yourself to your patient. You want to state a little bit about yourself and what your passion is. These phrases can all begin with, my name is, I've been a dental hygienist for, my specialty is, my passion is. So an example would be, hi, I wanted to take this opportunity to introduce myself. My name is Tricia Wonderly. I have been a hygienist for 30 years, taking excellent care of my patients so that they actually come to love coming to the dentist. I wanted to just share with you that I am very passionate about the newest research in dentistry called the oral systemic movement. That means that the bacteria that's in your mouth can actually travel into your bloodstream and to other places in your body. So one of my main goals is to help my patients understand that and how I can help them stay as healthy as possible. Now, I would love to know more about you. That's a great introduction to be able to ask your patients some questions. You really want to ask them anywhere between 1 and 3 really good questions to get to know your patients. Basically, you're going to want to know who they are, what's important to them, and why they would say yes to any treatment you're going to be recommending. So in order to get these 3 questions, here are some topics and some sample questions that you want to just listen to, and if something really strikes you or resonates with you, go ahead and keep track of these because these will be the ones that you'll use over and over again typically, but you'll have flexibility based on the situation with your patient. So if it's about them personally, tell me a little bit about yourself. Where are you from originally? So what do you do for your career? What do you love about your job? Do you have any interesting hobbies you can tell me about? And do you have family here? It's also really important to understand why that person is with us today. Why are they in your chair? You can ask them, so can you tell me what specifically about us made you choose our practice? Or what motivated you to make an appointment with us today? Or do you have any special requests or focuses regarding today's appointment? You definitely want to know about some of their dental history. So one of the questions might be, what were your previous dental experiences like? What should we know about your past dental history? Are there any areas that are typically sensitive during a cleaning? Have you ever had a root canal, crown, or any major dental work? Have you ever been told you have an infection like gingivitis or bleeding gums? Have you ever had a deep cleaning, scaling, root planing, or gum surgery? Have you ever been told you have an airway problem or sleep apnea? You definitely can ask them about their smile. What do you like best and least about your smile? Once you've asked these 3 questions to understand them, it's important that we understand what's motivating them. Basically, a question simply put, so how does your smile or the health of your mouth impact your occupation or your family or your recreation? And the reason we want to know about those 3 categories, occupation, family, or recreation, is because those are typically the categories out of which people will choose to do treatment or not. We definitely don't want to come back and say to our treatment coordinator, so the reason they didn't want to do it is because of money. It's too expensive. money always can actually fit into one of these other categories. So it's too expensive because they're not spending their money on their mouth. They're actually going to go on a trip, or they're putting their children through college, or they are in the middle of changing jobs. All three of those are really under the category of occupation, family, or recreation. We do want to know what's important to them. So you can ask them, if you had to rate your mouth, what's most important to you? Having no infections, having pain-free dentistry, having whiter teeth, straighter teeth, keeping your teeth for a lifetime, having mouth infections that impact your body, having fresh breath or a confident smile. Now, obviously, you're not going to go through and read all of these, but keep in mind all of these really good questions that you can ask your patients to help understand what's important to them. And then this is a really pivotal area in how we want to have conversation with our patient. We absolutely need to know what their long-term goal is. So you want the patient to know that you are their advocate. And I would come out right and just tell them, as your patient advocate, it is really important that I know what you would like to achieve long-term in our practice. We have many lifelong patients here, and I want to make sure that we are always meeting your needs. So what is your long-term goal with your oral health? Now, when they give you an answer, it's really important to remember the words that they use, because those same words are the words you want to give back to your doctor or your treatment coordinator when you're relaying the information to them as to why they would want to do treatment. And if we can use their own words, you're definitely going to resonate with them on a deeper level than if we didn't use their own words. And lastly, just thank your patients. Say thank you for sharing with me. As your patient advocate, it's really important that I know this so that I can always make sure that we are moving in that direction to achieve your goals and to make the best decisions in your care. So once you've asked those questions, once you've introduced yourself, asked those questions, found out their long-term goal, given your advocacy statement, it's really important then that we begin the appointment, but you want to inform before you perform. So this would be a typical conversation I would have with a patient who's new to the office. So today you're scheduled for 2 hours for your initial appointment with me. We will collect some information for the doctor to come in at the end of your appointment, starting with a full set of x-rays. This is going to provide critical information so we can look for cavities or any infections. Next, I'll perform a complimentary oral cancer screening, a head and neck exam, and a sleep apnea screening. I'll then chart what is currently in your mouth and document any existing work, as well as anything new that I would like the doctor to look at today. Our philosophy is to share with you everything up front so that you don't feel like you're hearing something new every time you come in. We will go as fast or as slow as you would like to achieve your dental health goals. I'll also take photos of your teeth so you'll be able to visually see everything we're seeing. And most importantly, our main role is to provide a thorough oral systemic examination. We're going to screen to see if you have any bleeding gums or even bone loss in your jaw. And if everything is healthy, then we'll go ahead and we'll clean your teeth today and get you on a healthy 6-month program. So what questions do you have for me before we start? At that point, you're going to go ahead, answer their questions, and get started with your diagnostics. But for the purposes of this PowerPoint, I just wanted to at least go back to advocacy. We want to assure our patients that if at any time they have any questions or concerns regarding their treatment or anything we're discussing with them, that they can feel completely comfortable to talk to you and consult with you. And once the patient knows you, you can now get to know them. That's when you have earned the right to go into their mouth. So here are some facts about being an advocate for your patient. Depending on the way your office is structured, if a treatment coordinator is the one who brings the patient to you, then they will introduce you and tell the patient a little bit about you. And they'll often give you the long-term goal and the personal motivator at this transfer because they've had that initial conversation with the patient. If the treatment coordinator gives you information that they collected about the patient, don't ask them the same questions, but just acknowledge the information that was passed on to you and then ask other good questions. But if you get the patient from the reception area, you can introduce yourself, shake their hands, ask them to accompany you to your room, give them a little mini tour as you're going through the office, just promoting the office and the highlights of it, promoting your doctor and promoting yourself, and point out any information like where the bathroom is located or where the check-in or check-out desk is. I want to emphasize the importance of getting your long-term goal. You really cannot go into your patient's mouth if you don't know what their long-term goal is. So make that a priority as you're asking your questions, to be specific about asking them what their long-term goals are. In addition to what we've mentioned, a way for your patient to relax a little in your office is if you use their name often and if you smile. The sweetest sound to any of our ears is our own name. So if you honor your patients by using their name, they're going to respond to you better. And then just smile. People are going to warm up to you and trust you more readily if you put a smile on your face. If you are more interested in them than you are in yourself, that will also score points as far as them feeling heard and valued, as opposed to feeling like they are just sitting there listening to your life story. So in addition to promoting yourself, we also need to promote our doctor. Some statements we can make along our entire appointment, depending on what the situation is, we can say, oh yes, Dr. Smiley's very gentle. I personally had her work on me, and I can assure you, you'll be in excellent hands. Or Dr. Lido is gifted at getting people numb. He goes the extra mile to make sure you're completely comfortable. Or if you have any questions or concerns, you can stop Dr. Patience anytime during your treatment, and she will explain everything to you. Now, how to promote your team. You can state some comments about them, because these are going to be the people that will be working with a doctor, and they also need to know that they can trust this assistant or other team members that they're going to be interfacing with. So you can say, oh, I've worked with her for many years and she's very knowledgeable and skilled as an assistant. Or you're in great hands with him. He really is an expert in his field and he can answer any questions you might have. Or she takes great pride in her work. She's a perfectionist and she's great at what she does. So the whole time you want to really promote and encourage and speak positively about your teammates and the doctor in your office. Now, what happens if you've done everything right? You've introduced yourself properly, you've gotten your 3 questions, you've had great conversation, you've used their name, you've smiled, you really have followed through on your communication being excellent with this patient. And at the end of the appointment, they still tell you no, they aren't really interested in the treatment that you are proposing. Are you ready for their no? Remember, we're their advocate. We're there for them. This isn't something where they have to do what we tell them. And so if somebody truly is coming alongside a person and being their advocate, it's okay if they say no to us and our treatment recommendations. But there are some things that you can do to be prepared to respond to them in a respectful, caring manner. You can say, that's okay, we can go as fast or as slowly as you want. Or no problem, I'm here whenever you're ready. Or where would you like to start? Or how can I help you today? So in becoming your patient's advocate, it definitely requires some very thoughtful conversation we're going to have with our patients. To summarize, we want to make sure we give a good introduction of ourselves. We always want to promote our doctor and our teammates. We want to ask the patient 3 good questions. And we want to make sure we actually give them an advocacy statement. And then we want to be able to explain what we'll be doing during their appointment. Thank you.